probably difficult for you to see from the same perspective that I will see it, but we'll give it our best shot. All right, so he's lying prone, very symmetrical, and his gluteal crease is right here. All right, so you can see gluteal, okay? Ischial tuberosity would be at the top of the thigh, right where the gluteal crease is, okay? So when I come underneath here, I'm chasing the bottom of that ischium, okay? And then I swing medially, okay? And I'm on it, okay? Fair statement, he's a thumb width away from gluteal crease. How does that compare to the left side? Find the bottom, which is called the ischial tuberosity, and swing in there. There's his crease. That would be about 3 thumb widths. Okay? Now when I look at AP relationship, the left one is posterior, and in this position, you know, higher. Okay? When I load it, and I'm springing the ischium forward, it doesn't move. I cannot take up the slack. When I come on the flat portion of the ischium, on his right side, I can load it, I can spring it, and it recoils, and now I let go of the load. Lower ischium, I cannot load it, I cannot spring it. Okay? The right ischium, okay, can't load it, can't spring it. Medial ischium on the right, no movement. Medial ischium on the left, no movement. Now, after we treat him, I'll show you the palpation findings, and I'll show you the mobility, and honestly, that ischium is supposed to deform. It should look similar to this. You should see, when after you take up the slack, you add the same force again, and the body should accept that motion, all right? Ligamentous tone. On the right side, I can deform the sacral tuberous. That's the easiest ligament to palpate. On the left, it feels like a rock. I cannot deform this guy much at all. Now I could come out here and chase sacrospinous. Feels to me like the same issues going on with the sacrospinous on that side. If I'm on the correct structure here, it deforms on the right. I'll stop filming here. I'll be back in 5 minutes, and I'll show you the difference. Thank you very much. It's about 5 minutes later, maybe it's 6, 7, 8 minutes. Here is his gluteal crease. We treated it. We restored normative spring in this direction. The sacrotuberous ligament on the left is now pliant. I can spring it. When I come outside of the ischium on the left, I can take up the slack. You can see it spring and recoil, and now I let go. On the right side, take up the slack until everything stops moving, and that moves. When I come medially, when I'm springing it medial to lateral, I push until the slack is taken out, spring it, recoils. Okay? Position-wise, interesting. It's really subtle on the right side. Right side looks like it's still medially positioned, but it's not as medial. You see this? Remember I showed you that there was 1 thumb width difference? There's a gain of like 3/8 of an inch there. But the left one dramatically came in. So his crease is right here, okay? And you can see that he's about 2 thumb widths. I think I measured it that way. I don't think I was like that. So that's the difference. The curious thing is going to be how his tailbone pain is, and you want to comment on that?
It feels perfect.
Okay. Stay there, please. Don't move. I just want to put up my contact information. So the point I was making is that the lower pelvis is critical. And with situations such as traumatic coccydynia, it's very important to balance the pelvic structure in all three planes of the body, okay? And we're going to wrap this up. Again, this was a case titled Coccydynia with lower pelvic fixation. This is my current website, heschmanualtherapy.com. I do consultation treatment, and we teach professional seminars, and we have a distance learning course. And here's my contact information. Henderson, Nevada, very close to Las Vegas. You can find me on YouTube. Just type in Jerry Hesch, H-E-S-C-H. And there's also a link from the website. We just started a nonprofit.
Yeah, this is amazing.
Cool.